Hey, it's Dr. Bill Williams here in Suwanee, Georgia. I'm home taking care of business, which is my ASEA business today. I work three jobs, and a lot of people say, why do you do three things? And I love to teach. I love to bring the new products and ideas to the dental profession. I love to work on my patients at the dental office. So between teaching dentists, motivating dentists, showing them leadership communication skills, I like to bring them new ideas. And I found about ASEA that it's something so revolutionary and so new that I had to share it with people. I couldn't just keep it to myself. The topic of our discussion right now, though, is what results am I seeing personally and among the people that I have personally interacted with in my patient population and my group of friends that I've introduced ASEA to this year. So let me talk about that first. Personally, I've been taking about 8 ounces of ASEA a day, rubbing the Renew 28 gel on the affected areas of pain or the skin that's irritated about 3 times a day. So I use what I call the average old folks regimen. That means if you're over age 50, you're probably going to be using more of the product than somebody who's younger, because we know that as you get older, you lose about 10% per decade of your ability to create the redox signaling molecule naturally in your body. And we need more as we age. And so I'll turn 70 my next birthday. And the good news, I'm not taking any medications. I'm not taking any prescription drugs. I'm not diagnosed by the physicians with any particular serious diseases that need medication. So I'm only taking the ASEA Via Redox and the probiotics that are a nutritional supplement. So it's good news. So I'm working these 3 jobs because I want to, not because I have to. And I'm enjoying my life. I teach dentists how to finish well. And that means that I teach dentists how to work hard so they can eventually slow down and do things they want to do, enjoy their last 20, 30 years on the planet. It's not good to work to your last day and then fade out. I want people to enjoy their lives, so that's kind of my goal. When you're talking about experience with redox signaling molecules, their effect on your body, here's what's kind of happened for me. I've had better sleep. I've had mental clarity. I've seen better skin condition. I've got some actinic keratosis that I've been having the dermatologist take off every 6 months for like 15 years. And I'll go down there and they'll freeze them off, cut them off, look at them under the microscope sometimes and see if there's any danger there with the cell division. And so over the years, I've learned, what to look out for. And since I've been taking the ASEA Redox and the Renew Gel, I haven't had any of these keratoses or these dividing cells removed at all from the skin because there haven't been any. So that's good news. I've had much less joint pain in my body. I've had less problems with flexibility. I've had a lot more mental clarity over the last couple of months. I started about 9 or so months ago with the ASEA, and so I've had more energy over that period of time. I was pretty healthy to start with, and so I didn't expect any major breakthrough, but I do have a lot more energy and I can do more, and I tend not to get as tired during the day. So it's all good news. Some of my friends, though, have had amazing changes. And so my personal trainer had one of the most dramatic GI improvements, where she was able to eat anything and everything after she started on ASEA. And before that, she couldn't even eat but about a third of the foods that were out there. They upset her stomach tremendously, caused her great pain. And so she had tremendous GI improvement. I had another person who was double over in pain all the time and had all kind of problems, and he was in 2 weeks totally a new man, just taking the ASEA. He felt better, had no increase in pain. Every day was a better day, and that's only after 2 weeks. I've had a number of people that had their skin look better, their legs look better, varicose veins that were in some people's legs just totally vanished as far as the way they looked. You couldn't even see where they were. because in 2 weeks of the Renew 28 and the ASEA Redox liquid, you know, it was just gone. So that was a great improvement in the visual effect of what the skin looked like and the moisturizing of the skin. We've had some dermatological effects that drugs couldn't handle, that the Renew and the ASEA made better. So amazing for some autoimmune problems that people have had. We've seen that firsthand. One of my physicians had that condition that got a lot better. So very impressive so far. Just the other day, I heard from the first person that I ever told about Redox. They didn't buy into the system. They didn't want to start being part of the business, but they did keep their mind open. And they said, I'll keep looking at it. Well, about 4 or 5 months after that, they came down with melanoma. A large melanoma was found on the top of their head, and they had to have surgery. They went to surgery, had that cut off, and I called them immediately upon finding that out, and I said, you know, you probably ought to be on the ASEA and the Renew just to kind of heal that wound. And they said, yeah, give me some. But they didn't use it for 6 weeks. And then they pulled it out and started applying it to the skin, just the Renew 28 on the skin where the surgery had been done. And for 6 weeks it had been bleeding and not healing so fast. And then within just a couple of weeks, the thing was totally healed up once they started the Renew. And it made a believer out of them, a total believer. And so they've referred people to me since that time. And it's been an interesting thing to see. So the word for you there is try to get your people to jump on that thing quickly and don't stick it in a drawer and think they'll get around to it. Get people on the 90-day challenge right away. If they start with you, get them to use it, because we know it works for everybody. We know it works in every case. It just works in different ways for different folks. So there's nothing better than seeing somebody healed of a major problem that is slowly healing. It speeds it up. In my practice, you know, that's kind of the reason I've jumped into here to discuss it with dentists, because I've seen such dramatic results in my practice. And I've seen people heal from surgical placement of implants and gum surgeries and gum disease and ulcers and things in their mouth. Dry sockets and extraction sockets heal faster, less pain. So I'm just saying, anybody who's doing surgery needs to have this adjunct as a pre-op and a post-op situation, because it works so well. Those are my first-hand experiences. I've seen them full straight on. I've seen the joint pains, the muscle pains less, and it just goes on and on how many good things I see when people start using the ASEA Redox and the Renew Gel on a regular basis. It's Dr. Bill Williams. And if you have questions, if you're a dentist and you want to ask questions about what I see and how I use it in my practice, feel free to give me a ring. Thank you so much.